It's a completely different model, and we meet the beneficiary where they are, and we quickly identify all of the challenges that they have, both medical and social, and we do our dead level best to address all those to give them a better outcome. And our motto is we try to keep patients happy, healthy, and out of the hospital.
Happy, healthy, and out of the hospital. Yeah. And that's one of the things I know. I think when I just started to learn about value-based care, I think I've been here, it's going to be 5 years. So learning to the Medicare space and what value-based care is about 4 years ago, and the differences that you can make in, the life of your clients. And obviously, as an agent, we're facing challenges every year, not only with the plan changes, but also with to your point, Paul, trying to continue to be the subject matter expert of your field and of the product that you sell, and within the balance of continuing to service and retain your book of business, but also continue to grow and find new clients and build those relationships and continue to be someone who's a resource to them. It's been seen in data and research that when a patient goes to a value-based care, and I know that specifically with some research from CVS Health and Oak Street, that around it says 171 per 1,000 patients versus Medicare benchmark of 303. So a roughly 44% reduction of the clients having to go to the hospital. So that is close to 50%, which will indicate that really we're providing real care and offering real time. So I'd love to, for those who aren't familiar, because we do have a mix here, right, Paul? We have agents who have been doing this for over 20 years, 30 years, and others who just started, this year. Yeah. So for those who aren't as familiar, how would you describe then, in your words, Oak Street Health and how you guys go into,
In a sentence, I'd say we proactively engage our patients to quickly, this is going to be more than one sentence, I figured it out, but we proactively engage our patients to quickly identify the challenges that they're facing, whether that is a health condition, several comorbidities, or whether it is, some aspect of their life, social or, psychological or anything like that. We have patient relationship managers.
Right.
And that is a role that we have in every one of our clinics. And when someone comes into our office, they don't sit in a waiting room, or certainly not for long. They go immediately to the patient relationship manager's office. And the patient relationship manager is responsible for just, sitting down with them and checking in, How are you doing? Are you having any problems scheduling any of your appointments? So on and so forth.
Yeah, getting to the...
And they build rapport. Our PRMs are amazing. They just the personality type they're delights to be around, right? But they engage the patient to find out the complete picture at every visit, the complete picture of where that particular client is, right? And I want to be clear about this. I like to deceive myself and say that I'm an expert in insurance. I haven't taken the AHIP for the first time in 21 years, or since it started in 21 years this year. However, no one else at Oak Street, and this is by definition, no one else at Oak Street is certified and ready to sell for any insurance plan whatsoever. We are not insurance experts, and we do not aspire to be experts, right? Yeah. So therefore, whenever we have a patient that comes in and we're getting all this information and they have a question about insurance, we need to be able to refer them back to the agent that sent them to us, right? So a little bit later on, I'm going to tell you guys about a process that we've put in place to help us identify who the agent of record is for our members when they come in. Because as you can see, with our PRMs, patient relationship managers, we are digging in deep to make sure that we've got the complete picture. And sometimes that means that they're going to be asking us questions we don't know.
Yeah.
We want to honor the relationship for the agent that sent that member to us so that we can refer them and provide continuity to that relationship.